Hello, my name is Rosemary Messer, and I'm going to be presenting on workplace violence in the healthcare setting. Workplace violence is defined by OSHA as any act or threat of violence, harassment, intimidation, or other threatening, disruptive behavior that occurs at the worksite. Each year, nearly 2 million American workers have reported being victims of workplace violence. Some employees are at a higher risk than others. For example, those who exchange money with the public, those who work late at night, those who work alone or in isolated areas, those that work where alcohol is served, or who care for people that are volatile or unstable are more prone to being exposed to this kind of violence. Healthcare workers care for a broad range of people, some of who are unstable. Healthcare and social assistance workers are almost 4 times more likely to be injured as a result of violence than the average private sector employee. The Bureau of Labor Statistics show in 2014 that the highest rate of intentional injury by another person occurs against employees of psychiatric and substance abuse hospitals. Out of every 10,000 of those employees, 109.5 were injured from intentional violence. That number is nearly triple that of the second most affected sector of employees, which the Bureau of Labor Statistics lists as other residential nursing care facilities. Surveys show that high-risk areas include emergency departments, geriatrics, and behavioral health, among others. Psychiatric and nursing aides are on the front line of care and are the most common employee injured by violence. This graph shows injuries severe enough to result in days away from work. This next table is just to give you a sense of the prevalence of workplace violence in these different areas. In 2014, overall healthcare and social assistance employees injuries intentionally caused by another person is 8.2 for every 10,000 employees. If I gave you a percentage number to represent the violence, it would not be impactful. It would sound like 0.00082 of healthcare and social assistance employees are injured as a result of workplace violence. But bringing this into perspective, in a general med-surg hospital, 6.7 per 10,000 employees are injured from workplace violence. A major city has, let's say, about 3 medical centers that support 3,000 to 5,000 employees, meaning that about 10 to 15 employees will be injured by workplace violence in a year. I mentioned before some high-risk areas like behavioral health. Take note of the extreme number of injuries against psychiatric and substance abuse employees. If we go back and take a look at this graph again, it is psychiatric and nurse aides that are most affected. It is also color-coded to represent the types of injuries documented in this survey. The most common types being hitting, kicking, beating, and shoving. It is important to be aware of the signals of a potentially violent situation. The early warning signs could be intimidation, disrespect, lack of cooperation, and/or verbal abuse. It then escalates to stage 2 when a person argues with those around them, refuses to obey policies or directions, begins to sabotage equipment, verbalizes intent to harm, seeks revenge, or sees self as victim or a me against them perspective. In stage 2 is where you may begin to see physical injury because of workplace violence. Level 3 requires emergency response outside facility security. Examples of this would be suicide threats, physical assault, raging, or using weapons to harm. The most common type of workplace violence is verbal abuse, shoving, pushing, hitting, slapping, and/or scratching. Verbal abuse is likely the most underreported because of attitudes around healthcare and the difficulty in proving the negative interactions. The victims of this also do not typically feel the support of their colleagues and employers. An attitude of needing thick skin to deal with difficult patients, doctors, or colleagues. Unfortunately, healthcare workers sustain injuries from gun violence, stabbing, being held hostage, and other traumatic assaults, even resulting in death. These are more rare, but healthcare facilities are on the front lines of helping the public. That means facilities are typically open to the public with very little screening of who is coming through the doors. Examples of these dangerous situations is incidents of gang violence overflowing into the emergency department or a behavioral health patient in crisis that takes hostages. There are many variations to possible violent scenarios. Keep in mind, 80% of injuries come from patients. Being mindful of those early warning signs can be key factors in preventing situations from escalating. Who is affected by workplace violence? It is not just psychiatric and nurse aides, or just the employees for that matter. Besides the victim of workplace violence, their fellow coworkers are also affected. Their family, clients, or patients, hospital administrators, and even shareholders are financially impacted. Employees injured by many may be awarded workers' compensation, which covers medical expenses and lost wages, but they also must recover from the physical and emotional injury. Some injuries leave lifelong effects. There is an emotional trauma to be recognized from this violence. Some victims have been diagnosed with PTSD and anxiety. This affects their personal life as well as professional. They may lose productivity and/or have increased stress levels. Coworkers also feel the emotional impact with anxiety and increase of stress. Some may also be affected by PTSD. When a nurse is injured and causes them to miss days of work, other nurses feel the impact through short staffing and working overtime, increased stress, and working with new people. There is a significant loss of productivity and loss of employee morale. Another effect is the impact of patient outcomes and lack of employee resources for patient movement. This could lead to injuries of employees from lifting and rushing through cares. These factors impact the employer heavily also. They are mostly financial implications. They must pay out workers' compensation, and with that, many hospitals self-insure, so that could be hundreds of thousands of dollars straight from the company. Employers are also faced with the cost of replacing staff. Replacing a nurse can cost between $27,000 and $103,000. Workplace violence also causes loss of employee morale, which compounds on the increased stress levels of the fellow employees. The turnover rate after a workplace violence incident is about 20%. Now that we have discussed who and how workplace violence affects healthcare workers, and particularly nursing staff who are on the front lines of patient interaction, it is imperative to understand the challenge we are facing. Many healthcare workers state they go into this field because they want to help people. It is in this attitude and culture that we have inhibited prevention. Their ethical duty that healthcare providers abide by of do no harm reinforces this. There's also an attitude of it's just part of the job and to grow thicker skin, which makes their sense of altruism worse. Altruism is putting others before yourself. In these cases, nurses may be putting their safety at risk to protect the patient. There is also the belief that patients didn't really mean it or they didn't know what they were doing, which leads staff to accepting the behaviors as routine or unavoidable. This leads me into the lack of reporting. Because of the aforementioned culture, many employees do not report bullying, verbal abuse, and other acts of violence. Many employees state a fear of retaliation or a lack of support for reporting these incidences. There has been lack of faith in the reporting system as well. The last and most valuable piece to understand is the lack of behavioral health system. People tend to present to the emergency department during crisis, and the ED does not seem to be the most appropriately equipped to handle these situations. The ED is also where patients end up when detoxing from alcohol, which can be a very scary process and has its own challenges beyond anxiety and acute medical conditions. This is also where patients who are recovering from substance abuse get treated, and with that comes behavioral issues. These situations with volatile patients can put staff at risk for violence. It is important to recognize these unique challenges so we can appropriately react with solutions. There are federal requirements for employee safety. I quote the Occupational Safety and Health Act of 1970 here. Although OSHA has no specific standard on the prevention of workplace violence, an employer has a general duty to furnish to each of his employees and a place of employment which are free from recognized hazards that are causing or likely to cause death or serious physical harm to his employees. End quote. States have also begun to pass legislation that criminalizes violence against healthcare workers. There's still more to do, though. Although more states are passing legislation on violence against healthcare workers, we need laws that require employers to improve workplace security, because that is going to be actually effective in keeping staff safe. Employers should provide training and accessibility to the security team. Examples being employees calling security teams, overhead paging them, and giving employees in more isolated areas panic buttons. Employers should have a workplace violence prevention program. There should also be a safety culture that promotes a zero-tolerance policy on violence. The security and healthcare teams need to work together to shape the prevention program and workplace violence policy to fit the needs of their facility. Prevention is key. Building trust among employees that again supports safety, a zero-tolerance policy, and reporting. An effective workplace prevention program includes the following pieces: management commitment and worker participation, worksite analysis and hazard identification, safety and health training, record keeping and program evaluation. Most healthcare security teams do have this, but all facilities that work with the public should have a plan like this. Healthcare workers are on the front lines of helping people get care. Nurses and their aides spend the most time with patients, and with that, 80% of injuries come from patients themselves. The behavioral health system is at the forefront of this problem, and it will take some time for that to change. In case I did not impact you on an emotional level with this heavy topic, I'm going to leave you with this video by a doctor who uses music and his healthcare knowledge as a creative outlet to spread awareness about healthcare issues we face. Here is Z-Dog MD.
No, we're done. We're done. You're under arrest. We're done.
Say something, I won't give up on you. I'll be the one if you want me to. Anywhere I should have followed you. Say something, I won't give up on you. And I'm feeling so small. It was over my head. I did nothing at all. And I did stumble and fall. I'm just trying to care, but they say it's my fault. Say something, I won't give up on you. I'm sorry that I couldn't get to you. Anyway, I should have followed you. Say something, I won't give up on you. And inside this inside. I went in this for love. Now I'm wondering why. Say something, I won't give up on you. And I'm sorry that I couldn't get to you. And anywhere I would have followed you. Oh, say something, I won't give up on you. Say something, we won't give up on you. Say something.